Welcome to the Deep Dive. Today we're plunging into the world of mental health services. It's a field packed with diverse and really increasingly vital career opportunities.
Absolutely. We've looked at information that paints a clear picture. It's a sector with significant growth potential.
Yeah, and roles for all sorts of interests and, educational backgrounds. Okay, let's unpack this then. Maybe start at the entry points. For people who are new to the field or perhaps thinking about a career switch,
Good idea. There are some really accessible starting roles.
like mental health technicians and direct care professionals.
Exactly. These are crucial frontline roles. The sources show they work directly with clients, in places like residential programs, inpatient units, day treatment centers.
So right where the care happens, what do you typically need for that?
Often, it really centers on personal qualities. Empathy, definitely.
Yeah.
Patience, good communication skills. And usually a high school diploma is the base requirement.
And what kind of work are they doing day to day?
They're supporting daily activities, keeping an eye on how clients are doing, helping with skill development, and importantly, documenting their observations.
That sounds like invaluable experience, really getting firsthand insight.
It is. You get insight into treatment approaches, different client populations, and like you said, that ground level view. It can really inform the whole treatment team. Kind of an early warning system sometimes.
That's a great point. Okay, building on that direct client work, what about residential counselors?
Right. So this role involves supervision and support, often in settings like group homes, supported living, or residential treatment centers.
A bit more responsibility there, maybe.
Generally, yes. The requirements might still start at high school completion, but our sources mention that associate degrees or equivalent experience are often preferred or sometimes required.
And their responsibilities shift a bit.
Yeah, the focus is more on implementing treatment plans, managing group dynamics, responding to client needs as they come up.
So it seems like that would give you a deeper understanding of maybe longer-term therapeutic relationships, seeing behavior change over time.
Precisely. You're often involved for a longer period. Then you have roles like case management assistants, more of a support function.
Okay, what did that look like?
These roles are vital for making sure services run smoothly. Typically, you'd probably need an associate degree or similar experience. Strong organizational skills are key.
And communication, too, I imagine.
Absolutely. The job involves a lot of coordination. Think appointments, records, connecting clients with resources, plus regular client check-ins.
So you're getting a good look at how different services connect.
Exactly. Insight into service coordination. And you develop really useful administrative and interpersonal skills along the way.
And we shouldn't forget the administrative support roles, right?
Yeah.
The backbone.
Definitely not.
Yeah.
Essential operational functions. Managing medical records, scheduling, insurance stuff, supporting specific programs.
The requirements probably vary quite a bit there.
They do, from high school completion up to more specialized training, depending on the specific job.
But still a valuable way in, getting a perspective on how the whole system operates.
For sure. And many of those skills are transferable across the whole healthcare sector, not just mental health.
All right, so those are some key entry-level paths. Let's shift gears now to the professional clinical roles. These usually require specific licenses and education, right?
That's right. These are often seen as the core of mental health service delivery. Let's start with social workers.
Okay, what's the typical path there?
So what's interesting is the breadth of what they do. The source material highlights that a Master of Social Work that's an MSW, a graduate degree, is generally required.
And then licensure.
Yes, followed by state licensure. That usually involves maybe 2 to 3 years of supervised practice after the degree.
And their responsibilities are pretty wide-ranging.
Very. Assessment, therapy, both individual and group case management, connecting people with resources they need. It's quite holistic.
And specialization seems common, too, focusing on kids or older adults or substance use issues.
Yes, many social workers develop specific areas of expertise.
Okay. Then we have mental health counselors and licensed professional counselors, or LPCs. How do those generally differ, or are they similar?
Well, the specific titles and the exact licensing rules can vary quite a bit depending on the state. But broadly speaking, both roles focus on providing therapy services.
In different kinds of settings.
Yeah, outpatient clinics, maybe more intensive programs, private practice.
And the education requirements.
Typically, you're looking at a master's degree in counseling or a closely related field. And again, state licensure follows after a period of supervised clinical practice. Similar timeline, usually 2 or 3 years.
And like social workers, counselors often specialize too, right? Maybe in trauma or family therapy.
Exactly. Or specific therapeutic approaches like cognitive behavioral therapy, CBT.
Okay. Now, psychologists. This generally means a doctorate, doesn't it?
That's correct. Usually either a PhD, a doctor of philosophy, often with more of a research emphasis, or a PsyD, a doctor of psychology, which tends to focus more heavily on clinical practice.
Plus a lot of supervised practice.
Oh yes, extensive supervised practice is required for licensure.
And what's distinctive about the work psychologists do?
They often engage in more specialized assessment using psychological testing, for example. They provide evidence-based therapies and might also get involved in consultation, program development, maybe research.
It sounds like there are many focus areas within psychology itself, neuropsychology, health psychology.
Right? Or working specifically with children and adolescents. Lots of potential specializations.
Then there's a really interesting blend of skills with psychiatric nurses.
Yes, this role really integrates nursing expertise with mental health knowledge beautifully. You have registered nurses, RNs, who can specialize in psychiatric care.
And then advanced practice nurses.
Exactly. Advanced practice psychiatric nurses, they hold master's or even doctoral degrees. They can provide therapy and, in many places, manage medication as well.
It really seems like a holistic approach, considering both the physical and the psychological sides.
It is. That integration is key.
And finally, when we talk specifically about medication management, the primary prescribers are often psychiatrists.
That's right. Psychiatrists are medical doctors. They have an MD or a DO degree. Then they complete specialized residency training in psychiatry.
So their main role is diagnosis and medication.
Primarily, yes. Diagnosing conditions, prescribing medications, and overseeing the overall treatment plan. Their medical background is crucial for addressing the biological aspects of mental illness.
Do they also provide therapy sometimes?
Some do, yes, alongside medication management. But the medication aspect is often central. And like other medical fields, they have subspecialties too.
Such as?
Child and adolescent psychiatry, geriatric psychiatry focusing on older adults, addiction psychiatry, forensic psychiatry. Quite a few areas.
Wow, okay. So that covers a really wide range of the core clinical roles. But the field keeps evolving, doesn't it? There are these specialized and emerging roles too.
Definitely. Let's talk about peer support specialists first. This is a fascinating area.
Yeah, using lived experience as a professional asset is powerful. But how does that work in practice? What kind of training turns personal experience into effective professional support?
That's a really important question. Peer support specialists bring their own journey with mental health challenges, but it's combined with specific certification training.
What does that training cover?
Things like active listening skills, how to share their own stories appropriately and helpfully, understanding recovery principles, ethics, and crucially, maintaining professional boundaries.
So it's structured support, not just casual sharing.
Exactly. They offer something unique, hope, practical coping strategies, guidance navigating the system, all grounded in that personal understanding.
It sounds incredibly valuable, that peer-to-peer connection. Okay, then there's applied behavior analysis, ABA specialists.
Right. These professionals typically focus on individuals with developmental conditions, especially autism spectrum disorders.
Using structured interventions.
Yes. The goal is to help develop adaptive behaviors and skills using principles of behavior change. There are different levels here, too.
Yeah.
You might have registered behavior technicians, RBTs, who implement plans, working under supervision, and then board-certified behavior analysts, BCBAs, who usually have master's degrees and do the assessment and program design, require specific education and supervised training.
Okay, and given current challenges, substance use disorder counselors must be in high demand.
Absolutely vital. These counselors specialize specifically in addiction treatment. They need both mental health knowledge and specific expertise in substance use dynamics.
What's the educational path for them? Does it vary?
It can vary quite a bit by state and the specific certification. It ranges from certificate programs up to graduate degrees. They work in all sorts of settings, dedicated treatment programs, integrated care settings, recovery support centers.
Another area getting more attention is trauma specialists.
Yes. As our understanding of trauma's impact deepens, the need for specialists grows.
What does that specialization involve?
It usually means building on a core clinical degree like counseling or social work with additional focused training and certification in specific trauma-informed therapies.
Right, EMDR,
Right.
or trauma-focused CBT.
Exactly. Eye movement desensitization and reprocessing, or TFCBT. There are also somatic therapies focusing on the body's response to trauma. These approaches often go beyond traditional talk therapy to address how trauma is stored.
It seems critical, given how prevalent trauma is. And finally, you mentioned integrated healthcare roles earlier. This sounds like a big shift.
It really is a very important emerging area. It's all about bringing mental and physical healthcare together, breaking down those old silos.
What does that require from professionals?
Well, you need an understanding of both systems, medical and mental health, and really strong skills in collaborating across different disciplines.
Can you give an example?
Sure. Think of a behavioral health consultant working right inside a primary care doctor's office. They can do quick screenings, offer brief interventions during a regular medical visit.
Making mental health care much more accessible, right when someone is already seeking care.
Exactly. Or health psychologists working in hospital settings, care coordinators linking everything together. It's about treating the whole person.
Okay, this is a fantastic overview of the roles. Now, for someone listening who's thinking, okay, I'm interested, how do they actually build a career in this field? What are the strategies?
Right. Moving from interest to action. Our sources offer some good guidance here. First is education planning.
Balancing maybe starting sooner with longer-term goals.
Exactly. Think about how an entry-level job might fit with future education plans. Also, look into whether potential employers offer tuition support. Many do. And flexible programs can help if you're working.
Good point. And then developing a specialization seems key.
Yes. Identify what really interests you, but also look at what the market needs. Then pursue focused training, get certifications, maybe find supervision specifically in that area.
Whether that's, say, child mental health or eating disorders or getting skilled in specific therapies like CBT or maybe DBT, dialectical behavior therapy.
Precisely. And speaking of supervision, finding good supervisors is absolutely critical, isn't it?
It sounds essential.
It really is. Seek out supervisors who will both support you and challenge you to grow. Quality supervision is where you refine your skills, develop your professional identity, navigate those tricky ethical questions.
And it doesn't stop after licensure.
Well, way! Ongoing consultation with trusted mentors or peers is invaluable throughout your career.
Networking also seems really important. Connecting with others in the field.
Definitely. Join professional associations in your field or area of interest. Attend conferences or workshops if you can. Participate in learning communities.
What's the benefit there?
It provides support, you learn about the latest developments, and it helps you become aware of new opportunities or different ways of working. You build community.
Okay, and finally, something that feels incredibly important in a field that can be demanding. Self-care.
Absolutely essential. Not a luxury. It's a necessity for staying in the field long-term and doing good work.
So actively developing strategies.
Yes, strategies for preventing burnout and strategies for responding when things get tough. That means building strong support networks, both personal and professional, engaging in wellness practices that work for you.
And maybe continuing to learn and refresh your role.
Yeah, continuing education isn't just for requirements. It can keep things fresh. Sometimes shifting focus slightly within your role can re-energize you too.
Well, this has been an incredibly insightful deep dive. It really shows the huge range of careers within mental health services.
It's clear there are meaningful opportunities, really, for people with all sorts of interests and educational backgrounds.
And as you said at the start, and our sources confirm, the demand for qualified professionals at every single level is just going to keep growing.
Absolutely. As mental health becomes, thankfully, more recognized as just a fundamental part of overall health and well-being.
So for you listening, as you consider all these diverse paths we've talked about, maybe take a moment to think. Which of these really resonates with your own skills, your values? How could your unique strengths contribute to this really vital field?